Today we'll be doing our HTC, and first off, I'm gonna knock, apply hand hygiene, and I'm gonna greet my patient. Hi, my name is Neil. I'll be the one who's gonna administer HTC, and I'm gonna provide privacy for the patient, and then raise the bed on my working height position, and then side roll down. And before I even identify my patient, I'd apply hand hygiene before I touch him, and I'll be proceeding to do my two identifiers, which is the name and the date of birth. So can I have your wrist, please? Yes. And what's your name? Bob Square. Okay, Mr. Square. What's your date of birth? My date of birth is April 19, 1940. Okay, good. So now I'll be proceeding to ask him about his allergies. Mr. Square, are you allergic to any medication, food, environment, latex, and any of that? If so, what are your reaction? Yes, I'm allergic to bee stings and shrimps, and I tend to have itchy skin and redness. Okay, good. So now I'll be proceeding to do my pre-assessment, which consists of vital signs, pain, and skin assessment. So, um, first off, with his vital signs, I'm going to do his pulse, blood pressure. Pulse, respiration, blood pressure, temperature, O2 sat. So let's pretend that I'll be doing his pulse rate right now. So, Mr. Square, I'll be doing your pulse. I'll be getting your pulse. And do you prefer which arm you'd like me to do it on? No, I don't mind. I don't prefer any arm. Okay, good. So I'm just gonna do it on his right arm. So I'm locating his radial and all of that. And as I do his pulse, I'm also observing for his respiration for and for full minute or 30 seconds. And let's say I got it. Let's say I counted for full minute, and then his pulse rate is 64 beats per minute and 64 beats per minute, and it is within normal range of 60 to 100 beats per minute, and it is graded as +2. It is normal, and as for his respiration, is unlabored, shallow, and deep. It is and it's 12 beats per minute, and it's within normal range of 12 to 20 beats per minute. And after that, I do hit his the base of his blood pressure. So, Mr. Square, what I have here is my blood pressure cuff. I'm just gonna put this on your arm. Do you prefer which arm you'd like me to do it on? No, I don't mind. I don't prefer any arm. Okay, good. So I'm just gonna do it on your right arm, and if you feel any discomfort or pain, just let me know, or tightness on the cuff, just let me know, and I'll stop the procedure. Okay. So uh, uh let's say, but first off, I'm locating his brachial, and I'm making sure that as I get his the base of his pulse, I'm making sure that it is sighted on his brachial, so I could get the accurate information. Okay. And then let's say he got 220 for his base, because I multiplied by 2, and then I will proceed to do my blood pressure. I'm making sure that as I listen with my stethoscope, with my diaphragm, I'm not touching it. I'm not trying to touch the diaphragm with the cuff, and I'm also making sure it is an inch above the elbow. And then as I do that, um, let's say I got his blood pressure, and it is 118/80, and I'd verbalize, of course. Um, so his blood pressure is within normal range of 120 of systole and 80 of diastole. Okay, and now I'll be proceeding to get his temperature. So, Mr. Square, what I have here is a tympanic temperature. I'm just gonna put this on your ear. If you feel any pain or discomfort, just let me know, and it will just take seconds. Okay, so I'm just gonna pull out this here and put this in, and then I'd look, and then so his temperature is 35.5 degrees Celsius. It is within normal range of 35.5 to 38 degrees Celsius. Okay, now that I've done that, I'm gonna do his O2 sat. So let's say this is the O2 sat. So Mr. Smith, I'm just gonna put this on your finger. It doesn't hurt, but it will just take seconds. Okay, so his O2 sat is 95%, and it's within normal range of 95 to 100% um, for his O2 sat. And after I do that, I start with my skin assessment. And with skin assessment, I'm inspecting for any dehydration, uh, skin turgor, testing skin turgor. You do by pinching their, their skin above their clavicle right here on both sides, and you're also inspecting for any bruising, redness on the skin, because he does have allergies, and you'd want to assess that, and redness or irritation, and also masses or bruising and any of that. And then after I'd done my skin assessment, I tell Mr. Smith that I'll be right back to adjust to set up my HTC, my IV bag, and I tell him, Mr. Smith, I'll be right back. I have to set up the equipments for us to proceed, and if you need any help with anything, or if you have any questions, the call bell is onto your right side. Just press that, and any nurse will come for your need. So I lowered the bed, and then side roll up, making sure he doesn't fall. So, and I'm providing I'm sorry, I'm providing the Mr. Score's privacy on. I'm not closing the curtains. It's just I'm not opening the curtains. It's closed, so I'm just gonna leave that closed for Mr. Square. And then I go to my IV bag, and here we have our IV bag. So I'm making sure that I have the right IV bag. I'm making sure that I have the right bag. By doing so, you have to compare this with your physician's order, making sure you have the right solution, because you don't want to administer or give the wrong solution to your patient. And I'm also checking the patient label, so making sure that I have the right patient to administer this to, and I do. And this is for Mr. Bob Square. Okay. And we'll get our IV tubing. We'll grab our IV tubing, and also making sure that there's a label on it. And it is important to put the label on my IV tubing because it notifies the nurse, or it lets the next nurse know when they will change it and when not to, and when it will expire, so they don't waste supplies. So before I open my IV tubing, I'm gonna apply some hand hygiene and applying gloves, making sure I don't contaminate it. So let's pretend I opened it already, and then I put my label on it, so like this. So I'm making sure, so let's pretend that this has a cup sealed on it, and this one too. I don't have a cup right now that is sealed onto this, but let's just pretend that there's one. So as I'm touching this, I have my gloves on, so making sure I don't contaminate. So first off, I'm making sure that this is closed before I even insert it to my bag, making sure that this roller clamp is closed, and this adjusts the speed of the drop rate. So when it's all the way down, that means it's closed. And we also have this clamp right here to adjust the drop rate. Okay, and then we also have our label here. So I'm making sure that this doesn't touch the ground at all. So we're just folding it like this, and I'll be grabbing my IV bag with my non-dominant hand, and I'm gonna take the sealed off, and I'm gonna insert this carefully. Insert it, twist it. Okay, now that I have inserted it, again, I'm making sure it's closed, the roller clamp is closed, making sure that it doesn't drip. I'm gonna flip it here. Okay. And I'm making sure that This has a cup on. Sorry, this has. I'm making sure that this has a cup on, so it could be used for later, for such as connecting it to the connector or the butterfly, and that's all.